Okay, we'll go ahead and get started. My name's Stephanie Mackay. I'm the Director of Development for Columbus Community Center, and I want to welcome all of you to our second annual Bottom Line of Disabilities Symposium. We had our first one last summer, and it was a huge success and a reminder to me that having ongoing conversations around disabilities and the impact in our community is really essential on an ongoing basis. This event is co-hosted by Columbus and the Global Interdependence Center, and I want to thank our event sponsors, GE Capital Bank and Goldman Sachs, for underwriting the event today. I'd also like to recognize three public officials in the audience today. We have former Salt Lake County Mayor Peter Carone, former Salt Lake City Mayor Palmer DePaulis, and our current Salt Lake County Mayor Ben McAdams, who's our keynote speaker. I also wanted to introduce my co-host for the event today, Michael Drury. He's the chairman of the Global Interdependence Center and chief economist for McVeigh Trading and Investments. We're thrilled to see this record crowd of over 100 people who are willing to commit their time and have a meaningful and candid conversation with us about the impact of disabilities in our community. Mike Drury, if you'd like to come up and say a few words.
Thank you, Stephanie, and thank you all for coming. This is a wonderful event. I'm glad that GIC is able to help. We didn't really do much. We just let Stephanie loose, and after the first one, there was such great connections that it was very easy to get everybody to come. I think we have 7 here that came from GIC. Some will be speakers, some are just in the audience, and many friends as well. I would be remiss if I did not mention David Kotok and his former partner, the late Peter Demirali, who were the beginning of the connection between GIC and Columbus. And I think Peter would be more than pleased to see the turnout here that's come from his initial interaction with Columbus. And again, thank you all for coming.
In the last decade that I've worked at Columbus, I've always grounded myself in the sacrifice and the hard work on the part of our founding families. The genesis of all the disability services that we see in Utah today actually goes back to 1952, to a letter to the editor that was published in the Salt Lake Tribune by a respected local businessman, Richmond T. Harris, who owned Harrison Love Advertising. This was long before social media. A letter to the editor was social media in those days. I want to read this letter because it really, it's an amazing, to me it's just, an example of the power of one and how one person can really make a difference. I'm the parent of a mentally retarded daughter, 6 years old. I plan to keep her at home, but I want her to learn as much as she is capable of learning. I find there are no programs for her in the Salt Lake Valley. If you're a parent with a similar problem and would like to form a group and begin a daycare center, please call me at 35644. Even the phone number is old. After this letter was published, 50 families called the phone number within 24 hours, and those 50 families are the reason we are here today. The founding families and advocates exemplified how important a grassroots effort is in facilitating meaningful social change in our community. And their motivation really was a matter of life and death for some. One of our founding mothers, Donna Adams, who's 91, has become a dear friend of mine, has had both of her sons in Columbus through their entire adult lives. Her son, Ronald, was one of our first state students who walked in the door in 1968, and he worked here until he passed away a couple of years ago. I'm often haunted by the conversations I've had with Donna about the insensitivities and challenges she faced as a mother. She received medical advice to have her son euthanized. Her neighbors asked her to not let her children play in the neighborhood with the other little kids. Even her pastor asked her to not bring her children to church. 63 years after Richmond Harris published this letter to the editor, a handful of families changed how we look at disabilities, and Utah was in the forefront of that change. At this event today, we're able to honor the pioneering work accomplished by Original 50 Families by bringing together 100 community and business leaders in this room to have not just a local conversation, but a global conversation about human capital and social change. As I was putting these panels together, I was inspired by the upcoming generation of young adults who are entering the world with the expectations that they will live and work in the community as their peers do. Most importantly, they have the right to those expectations. Sarah, Aaron, and Jamie, who we have featured here, we recognized them last fall as Outstanding Workers of the Year, have all really been able to establish successful careers in the community because a lot of stakeholders have come together to make that happen. They exude the confidence that a 20-something who is discovering that they can make their way in the world, and it's just heartwarming as a parent myself of a 25 and a 27-year-old to see their confidence, to see the growth, to see their families so excited that their children are working in the community, and most importantly, that they know and they understand that they have a future and they have a right to that future to be fully integrated in our community. Today, we are the power of 100 people in this room. Let's honor the generation that fought the good fight to ensure that children could live safely and meaningfully in their communities. Let us take advantage of this opportunity to have a candid and global conversation about where we are and where we've been going, and where we can go. Today, let's dedicate the symposium in the honor of the first 8 young adults who crossed the Columbus threshold in 1968, Ronald, Lindsay, Stephen, Tylene, Patty, Steve, Ricky, and Martha, and thank their families for the sacrifices that they made to change the world for the better. And today, let us leave here with a renewed commitment to the next generation and their families to ensure that Aaron and Jamie and Sarah have rich and fulfilling lives, that their families have community support to guide them safely through the future. And let us have conversations today that will meaningfully influence what the next 60 years will look like for individuals with disabilities and their families and our community. And know that we really can make history ourselves in honor of all the work that was done 60 years ago by some of these founding families. So we have a wonderful program today for just a little bit of housekeeping. We've got food and beverages and bathrooms in the back. We'll be taking a couple of breaks in between our panels. And I also wanted to point out that we have a wonderful photo display by a renowned artist, Rosalie Winard, featuring Temple Grandin, who most of you know, and some other individuals with autism who she's documented over their lifetime. So now I really have the honor, this is such an honor to introduce Salt Lake County Ben McAdams as our keynote speaker. Mayor McAdams was sworn into the office as our mayor on January 7th, 2013. He's pledged to work collaboratively across party lines to find efficiencies in county government and to be open and accountable to citizens. During his tenure, he's championed education. He's helped the county become the first in the country to partner with the private sector to offer greater access for quality preschool for low-income children. He's emphasized economic development and job growth. He's partnering with cities to attract new businesses, and he's a careful steward of taxpayer dollars, and he's a careful steward of our community. He's supported greater access for business and residents to our community through transit, trails, and open space. And he's been in the national spotlight, and he will be this week, for his efforts to leverage private government and nonprofit resources to transform the delivery of social services while demonstrating social or system-wide change. We're very honored to have Mayor McAdams, and if you'd like to join us, the stage is yours.
Well, thank you. It's such a pleasure to be here with the Columbus Center today to commemorate maybe some of the great things that have happened over the life of the Columbus Center, and I think embark on a new chapter of many great things to happen in the future. Salt Lake County, Salt Lake City is a great place to live, and largely because of our focus on opportunity and creating opportunity for all in our community. I want to tell you a little bit about the work that we've been doing that brought me here today. Some of you are familiar with the notion of pay for success, commonly called social impact bonds, but for reasons I'll explain, I try not to use that terminology. It's not a bond. So when I was elected as mayor of Salt Lake City, or Salt Lake County, okay. When I was elected mayor of Salt Lake County, we were looking at some of the programs that are happening in our community where we might have an impact. And one of the areas that I was exposed to, I serve on the board of the United Way of Salt Lake, and they had done a lot of work in the area of early education and looking at some of our at-risk kids, and all this data. I had read some of the data, but there's a lot of data done by Nobel Prize-winning economist Jim Heckman, and Heckman started looking at some of the social interventions largely focused around recidivism, and seeing that there are cases where you see this intervention. We know, for example, that jail and prison is incredibly expensive to the taxpayer and also incredibly ineffective. We call incarceration, we call it the correction system, but the success of the correction system is pretty abysmal. We know, I know that when 10 people who are released from the Salt Lake County to jail today, Salt Lake County operates the largest jail in the state, that if 10 people are released from the Salt Lake County jail today, 6 of them will be back in jail for other crimes or parole violations within 6 months to a year. Not a very good success metric, and when you look at how expensive that is, it really has some pretty dire consequences to the taxpayer. Well, Heckman looks at that and says, well, how do you start breaking that cycle of significant expense and also poorly performing interventions? And you start linking together, and you all can see where this goes. But the first step was, well, if we start intervening when they are released from jail, if we give them some drug treatment or behavioral and mental health counseling, that improves the success of someone who's leaving the jail and can actually reduce recidivism. Well, then you link up the next study and say, well, if we can intervene before they go to jail, because one of the problems is when they go to jail, they make connections. Many times they learn how to be a better criminal. So let's catch them before they go to jail and see if we can stop them on that trajectory. And you look at kind of the dominoes that fall in an individual's life that lead them to jail and prison. And these dominoes are pretty well established. The statistical correlation between these dominoes are pretty significant, but it's unemployment. When you go back forward, it's dropping out of high school, it's drug use, it's gang affiliation in middle school. It's and you look, and some of the earliest dominoes we see. One of the earliest dominoes we see is that in Utah, we will administer a statewide standardized test at the end of second grade. And we will see that many of these at-risk kids, there's a correlation between how they perform on the standardized test at second grade and their lifelong chances for these dominoes to fall. And so we see that at the end of second grade, there are some of these kids that are performing so far behind grade level that they need some form of special education or intervention. And I want to clarify, there are different types of kids. There are many kids on our autism spectrum or other special needs who need some of this intervention, and it's a different analysis, and I'm happy to talk about that. But some of the kids that we're looking at, there's no physical, social reason that they should fail other than the zip code that they were born in, the family that they were born in. And that really predetermines their success or failure. So we look at the average child will start kindergarten with a vocabulary of about 1,100 words. Many of these at-risk kids will start kindergarten with a vocabulary of 300 to 400 words. Well, it doesn't take a Nobel Prize-winning economist to tell you that when you start similarly situated kids with similar potential and ability but they start kindergarten with a vocabulary of 300 words versus 1,100 words, they're not going to absorb the learning as fast. And by the end of kindergarten, these kids are further behind, and by the end of first grade, and then by the end of second grade, when we administer the test, they're so far behind that it triggers this state-funded intervention that's very expensive. So we look at this, and there's data that shows that if you can intervene with these kids at the age of 3, you can literally close this achievement gap at the end of third grade so that they'll test at third grade and not need special ed, which is the first domino that doesn't fall, and many times and statistically linked that these other dominoes are less likely to fall. So we look at this and we think, well, the old adage that an ounce of prevention is worth a pound of cure. And in this case, we know with a high degree of reliability that this intervention for these at-risk kids at the age of 3 and 4 is very likely to be successful and pretty cheap, relatively speaking. And the cost will hit, first of all, starting in the third grade when we're paying about $2,500 per child per year for special ed. Well, we know when they enter special ed, very few of these kids will leave special ed. And the dominoes start falling to ultimately a high degree of correlation between this path and crime and prison and jail. So incredible consequences. The ounce of prevention is fairly cheap. Pound of cure is fairly expensive. How do we break this cycle? This was brought home to me when, shortly after I started as mayor of Salt Lake County in 2013, I had the chance to go and visit one of these preschools. And when I was in that preschool, I met a young 4-year-old. Her name was Lovey. Adorable name for a 4-year-old. I'm not sure how it works at 40, but adorable little girl. And she was in a preschool program that was funded by Salt Lake County. And I knew all the statistics. But when it became not a statistic, but a person, and I knew that the fact that she was in that school that year because of a really fairly nominal investment by the taxpayer, the course and trajectory of her life would change so dramatically because of that simple act, or at least statistically. Not everybody's going to succeed, but the statistical chances for success for Lovey were so different because of that intervention. I had to ask myself, why can't we do more of this? So Salt Lake County entered into the first in the nation, actually probably the first in the world, Pay for Success or Social Impact Bond for early education. So this was modeled after something that had happened in the UK in 2012, and New York City later in 2012, and then Salt Lake County. And the UK and the New York City examples were focused on recidivism. So it was that later intervention notion that when somebody's released from a jail or prison, they have a 60% chance of recidivating. If you can lower that recidivism rate, you can save taxpayer dollars and actually make an impact in these people's lives. But how do you pay for it? The question is, how do you pay for it? I said the adage is an ounce of prevention is worth a pound of cure, but all of my budget's already being spent on cures, or sadly more often Band-Aids, that I can't afford that minimal ounce of prevention. And when we can't afford it, it's nothing more than a small pilot or a small intervention. So this notion of pay for success or social impact bond is to look ahead and see the high social cost and cost to the taxpayer that will incur for failure to take action, that will incur in a few short years if we don't act, and say, well, if we can save money down the road by acting today, why wouldn't we? And the only reason was we don't have any money. Well, my background was corporate finance and law, and I thought, well, we in the private sector, in the legal context, do this all the time. We know, I did a lot of transactional work with Latin America, and they say, if we could only have $1 billion to put up cell towers, most of Latin America didn't have landlines. They hadn't run the lines. These are developing countries that hadn't had the financial capacity to install telephone lines throughout the country. But they said, if we could have $1 billion to put up cell towers around Brazil, then we can start selling cell phones and people will sign up for these plans and we can pay that back pretty quickly. So in the private sector, what we do is we issue a bond, we raise $1 billion, they go and put in their cell towers, and then over the course of 5 years through monthly subscriber fees, they paid off that $1 billion and actually made money. And I thought, why can't we apply that same notion to preschool? If we know that government will save money, in this case it wasn't in the private sector, it was make money, but if we know that we can save money on one of these Band-Aids or cures that we're trying to fund oftentimes too late, and we can intervene early, why wouldn't we? So we entered into a pay for success contract where Salt Lake County and what happened is the J.B. Pritzker Foundation and Goldman Sachs came in up front and funded a 600-child preschool program. in Salt Lake County. And then we, Salt Lake County, signed up, and also with some support from the United Way of Salt Lake, said if these kids who are in a preschool program at age 3 and 4 are reading at grade level at the 3rd grade, then we will pay back the cost of this program, because the program will have succeeded, we will have saved tax dollars, and let's do this. And so we signed up and we did this. Now, we have, Lovey was one of the 600 kids that participated in this program, but I have to think about the thousands and thousands of kids who weren't lucky enough to get into our 600 child pilot program. And the question I think that we're asking today, if we have a capability like we've never had in human history to understand our challenges, and with big data and metrics and studies to quantify how successful interventions, how our interventions, our work is. Why can't we go to scale? I think the challenge is now taking successful interventions to scale. For me, it's not good enough that 600 kids, including Lovey, got into a program when there are 30,000 kids on a wait list who need the program tomorrow. So going to scale. And so for me, Pay for Success is a tool that can help us go to scale, because it's not about the old tired political debate of some on the left saying we want to raise taxes and spend a whole bunch more money in social programs, and some on the right saying these social programs are mediocre, we need to cut them. It's coming together and saying government and the people in our communities are going to pay the cost of failure. So if we're going to pay the cost of failure, can't we pay the cost of success, Pay for Success, and do that in a way? The funding then comes from future cost savings, from harm avoided, cost avoided in the future, and we capitalize that today to fund our interventions. We're today the day after Martin Luther King Day, so it would be appropriate for me to share a quote. Martin Luther King said, "The time is always right to do the right thing." And for me, that's ever more profound in the context of some of the work that you all are doing, and that we are doing, to say that we know, we have a sense for what works and what interventions work and how we can help people be independent, self-sufficient, have a higher quality of life. We know that in many cases that will save tax dollars, that will that's what families want, that's what the individuals we serve, what they want. Why, if we know what works and we know that it's more expensive to not intervene, why are we not going to scale with some of these interventions? So I want to read a story that I'm sure you've all heard. It's a lot cliche, but I want to read it and then give you a little twist on it. You've probably all heard the story of the starfish. Once upon a time, there was an old man who used to go to the ocean to do his writing. He had a habit of walking on the beach every morning before he began his work. Early one morning, he was walking along the shore after a big storm had passed and found the beach was littered with starfish as far as the eye could see, stretching in both directions. Off in the distance, the old man noticed a small boy who was approaching. As the boy walked, he paused every so often, and as he grew closer, the man could see that the boy was occasionally bending down to pick up an object and throw it into the sea. The boy came closer still, and the man called out, "Good morning, may I ask what you're doing?" The young boy paused, looked up, and replied, "Well, I'm throwing starfish into the ocean. The tide has washed them up onto the beach, and they can't return to the sea by themselves. When the sun gets high, they'll die unless I throw them back into the water." The old man replied, "But there must be tens of thousands of starfish on this beach. I'm afraid you won't really be able to make much of a difference." The boy bent down, picked up yet another starfish, and threw it as far as he could into the ocean. Then he turned, smiled, and said, "Well, I made a difference to that one." So that's a great story, and I think in many ways talks about the Loveys and the people. I'm sure you all have names with some of the people that motivate you to do the work that you do. And I like that story, but it's always sat a little wrong with me, because I think, well, what if he had a four-wheeler, a sand buggy, and he could go and get more? And what if he had like a big rake and could get them all up? And like, should we be content? Yes, I don't want to minimize that we make a difference to the one, and that's so important. But I wonder about the 10,000. And if we know we're making a difference, how can we reach the 10,000? And I think Pay for Success is a tool. Not the only tool, but a tool to accomplish that. In my mind, Pay for Success does two things. It allows us to do more. It removes it has the potential to remove some of the financial obstacles to doing more, constrained budgets, and if we can link through data the long-term and even short-term impact that the interventions that we do will have, it allows us to do more, to expand and to start going to scale with some of the programs. The other thing Pay for Success does is, I think, it helps us to do better. We are in a day and an age where, as I said, the tracking of data, the reporting of data, the ability to measure the impact we have is real. And not all interventions are created equal. Not all preschool programs are created equal. Some, as we were looking at preschool programs, we don't know. Some of them are good daycare centers, and others are good lifetime learning and will help to close the achievement gap and put these kids on equal footing. Pay for Success, I think, will help good providers, and I don't feel any hesitation to say this to the Columbus Center, because they are one who is a successful provider. But far too often in the work that we do, the work that you do, you probably see this. Money follows the great speaker or the great motivational brochure. And we're entering a world where money needs to follow success and data and impactful interventions. And in my mind, Pay for Success, in our preschool program at least, Pay for Success helped us to accomplish both of those. It's going to help us do more. It's going to help us as we start moving to scale, to get these kids into a program that will make a difference. But it also required us, because we were making a very close linkage between the intervention and an outcome, it forced us to examine and articulate the goals we want to achieve, and taxpayer money in this case will only pay when that goal is achieved. So we're going to be measuring the effectiveness of various outcomes, and there's going to be pressure for continual improvement. Now, we pay on a per child basis, so if the program is 80% successful, we'll pay 80% of the contract amount, and that will be successful, but there will be questions asked and people pushing to say, well, what do we need to do to make it 90% successful? Which brings me back to the starfish. And we are making a difference for the one, but what about the 10,000? I want to tell you about two other starfish in my life. One, I actually had the opportunity yesterday to go to breakfast with a friend of mine, John. And I told John I'd be telling his story, and he's okay with that. But John moved to Utah some 20 years ago. His girlfriend was working at a ski resort. John doesn't ski, says he tried once, but never could get it. John followed his girlfriend here, had a job, and the relationship didn't go as he hoped, and that threw John into drinking and alcoholism, and John lost his job. John was embarrassed about his circumstances and didn't want his family back in Michigan, where he's from, didn't want to reach out to his family. And John, he said, through some stupid stuff he did, his roommate kicked him out, and John found himself living on the streets and spent 2 years living on the streets, in the homeless shelter, and in and out of jail and other programs, and very expensive programs, by the way, as we know. John, after 2 years living on the streets, John did get a job that he held down for about 2 years, and returned to alcohol and drugs and crime, and once again found himself homeless for another 3 years, living on the street, in and out of the shelter. Very rough life. John, 7 years ago, Salt Lake County and Salt Lake City participated in the construction of Palmer Court, a supportive housing unit for people like John, who are on the street, have a hard time holding down a job, need some behavioral health treatment, mental health treatment, substance abuse disorder and other uses. John found himself in Palmer Court, and he says, that's when my life changed. Not to say it was easy overnight, but John today has been in government housing for about 7 years. John usually holds down a job, although he's looking for a job now. But John was happy to report a few things to me yesterday, that he is 2 years completely sober, 7 years mostly sober, he said, but 2 years 100% sober. That he is on the board, the consumer board of some of our homeless providers in Salt Lake City. And John also said a few things that he said to me. He said, for the first time in 20 years, he says, I was getting ready for my day a few weeks ago, and I remembered that it's my brother's birthday, and I called my brother to wish him happy birthday. He said, that has not happened in 20 years. And he says that relationship with his family, he's hoping to go back to Michigan later this year to visit his family. And when I think of the starfish, it matters to John, what we've been able to do. I also think of John was telling me there's a long wait list, and in fact, they're closing the wait list. They're closing applications again in a couple of weeks because of a backlog of need over supply. So I think of John, and John for me is one of those starfish that not only is John's life and his family's life so much better because of the successful interventions that have happened in his life, and if I might not to be cold-hearted, but also we're saving taxpayer dollars. Now, yes, John is in some government housing. John's receiving some support and other counseling through government sources, but it's a heck of a lot cheaper than housing John in the jail and sending John to the emergency room and the victims of crime and other circumstances around this. John is a success story, and I want to do more of that. I want to see more Johns off the street and remembering their brothers' birthdays. The last one I want to talk about, and I wanted to leave a little bit of time for questions. Have I left time? Do we have a few minutes? Or okay, is Ben. Now, my name's Ben, so Ben's parents brought him to meet with me. Ben was 5 years old and on the autism spectrum, and I was a senator at the time in the Utah State Legislature, and they wanted me to meet Ben because the legislature was considering insurance reform to cover our kids on the autism spectrum. And I met Ben, and Ben for me is another starfish. And Ben had an impact on me. That year, Utah did not adopt insurance reform, but some steps were taken, and every year steps are taken to start to serve some of these kids. These kids, while different than the kids that we've treated in our preschool program and different than John, the analogy is very clear that an ounce of prevention is worth a pound of cure. And if we can intervene with what works and more of it, we can change these kids' lives. And if we don't grab them when they're 3 or 4, let's grab them when they're 15 and 16 or 25 or 30. And that's, I think, the work of the Columbus Center. I think there are some direct applications of Pay for Success in this area as well, because early intervention will save costlier Band-Aids and cures down the road. So I look forward to continuing to explore as this notion develops. Pay for Success, I think there have been 3 transactions done in the country now. There will be another 10 this year. Salt Lake County is hosting over this week a symposium on Pay for Success where we hope to use this tool to further expand both doing more and doing what works. Thank you.
Any questions? Do we have any questions?
Utah's famous for their volunteer efforts and posted things. Have you tried to figure out how to fund volunteer force into your Pay for Success?
I think so. I mean, well, we haven't yet, but I think that one of the things that Pay for Success does is, in my mind, it gets me out of micromanaging. I'm a lawyer. I have no idea what works in early education, but far too often what happens in the past, and I think this is the other thing I would say that Pay for Success does, it does help to break this partisan divide. My counterpart in championing Pay for Success is conservative Speaker of the Utah House, Greg Hughes, who also sees the benefits of this. And we joke with each other, and he says, Ben, this is so fiscally conservative. Are you worried that people are going to think you're a Republican? And I say to Greg, just don't tell your colleagues that you're helping people while you're saving money. You know, they might not support it. But breaking the partisan divide, and I think one of the things it does is far too often in the past is you'd look at the data and you'd say early intervention matters, so I'm going to get in and pick a preschool program, and maybe we'll do some procurement, we'll put some people on the committee to pick which is the right program. None of them have PhDs in early education or drug treatment, and we pick something that we're as guilty as anybody else, of the money following what's compelling, not necessarily what works, not compelling from a data perspective. So what I hope it does is it maybe forces me to take a step back and say, I'm going to pick an outcome. I'm not going to pick the means of getting to that outcome. And then you have the providers. Hopefully it's yourselves, where if government's not dictating how you provide a service, that you figure out what works and what's missing, and how. I think volunteerism is part of that. How do you bring in volunteerism? But if you can reach more individuals and amplify your scope by using volunteers in the right way, then then we're going to support those who can have the maximum impact. Okay.
Mayor McAdams, thank you so much for being here today. We have a little gift for you. So let me stand up here so people, come on up here so people can hear me. So anyway, I wanted to give you these 3 books. The first one, That Went Well, is written by Terrell Dugan, whose father was our founder, basically, of all of our services here. It'll be good homework for you. It's a great history of disability services and one family story. And I also had the honor of meeting Graham Simpson, who's written The Rosie Effect and The Rosie Project. I don't know if you've read him or heard about him, but delightful stories of the first-person point of view of a man who's has Asperger's and sees the world in a very different way. And there are wonderful books to help us see how some people see the world in a different way and how we need to acknowledge that. So I know you have nothing better to do with your time, so thank you for your time, and thank you so much for being here. We really appreciate it. Big hand. Thank you so much.